Ourselves here. We'd like to thank all of you for coming, and first of all, we want to say, how about those Orioles last night? Did a great job, so they're going to get the chance to go to New York here. We want to thank everybody. My name is Tony Nagy. I'm with Smith Seckman Reed. I had the privilege of working on this wonderful project here at the Johns Hopkins Hospital. And in behalf of everybody who made this event possible, we want to personally welcome each and every one of you and thank you for taking time out of your busy schedule to be with us today. We, first of all, would like to start by thanking Johns Hopkins Hospital for letting us use their beautiful facilities they have. And, I mean, isn't this a magnificent hospital? I mean, it really is. And we truly appreciate and want to give them a big round of applause for having us use this facility. Also like to thank our partners, which is one of them, Johns Hopkins Hospital, and then M-HIMSS for being our partners and helping sponsor this. And also our panelists, which we'll introduce them shortly, for being a part of this and helping us make this event possible. We also had some girls from the Volunteer School of Nursing that were able to help us. And I think I have misplaced their names. I apologize. Oh, no, here we go. Maritu Halio, Stephanie Lee, and Rosemary Vu. So we want to thank them for helping out, and also our vendors for coming up and setting up for us and being a part of this event. It's nice to get and see some of the technology that they're bringing in and where it's going in the future. We also would like to make a special thanks to somebody. If it wasn't for them, and I kid you not, honestly, we couldn't have pulled this off by ourselves. Really. We'd like to thank Michelle Thompson. Michelle? Michelle is the brainchild of making all this happen, and we want to thank her, and we'd like to present her with a bouquet of flowers. And we appreciate all your hard work. Really, we couldn't have done this without you.
You're welcome.
She's been great. And just a few reminders. In the auditorium here, it's okay to have bottled water, but they would appreciate if you didn't have any other kind of drink in here or any kind of food in the auditorium. If you need the restrooms, they're just right across the hall here, outside the doors. And then please, if you don't mind, if you can put your cell phones on vibrate or silence them so it doesn't cause a distraction during the summit here. And also, if you like your AI credits, we have a form that you can sign at the registration desk outside. If you haven't already done so, before you leave, make sure you stop by and sign up on that. Now I'd like to introduce Scott Johnson. He is one of the vice presidents of Smith Seckman Reed. He is over our technology group, and he's going to be facilitating the meeting for us today. Scott?
Thank you, Tony, and thank you everyone again for coming today. We have an extraordinary circumstance and a confluence of different circumstances in our industry relative to healthcare reform, the ever-changing landscape and advances in technology, and how we manage that for the best delivery of patient care and cost-effective care. And I'm so excited that we can look at this issue through the lens of such a broad variety of experts in our field. And I would like to take a moment to introduce them to you, going right to left. First is Howard Reel, Senior Director of Facilities Design and Construction here with Johns Hopkins Health System. Next is Carrie McDermott. She is a Senior Policy Director with West Health. Sorry about that, Carrie. Then we have Mike McCarty, who is the Senior Director and Chief Network Officer here for Johns Hopkins Health System. We have Mark Shagru, who is the Director of Health Industries Advisory for PricewaterhouseCoopers. Lisa Charan, who is a Vice President with Mitchell Planning, Medical Equipment Planning. And then we have Dr. Harry Greenspun, who is the Senior Advisor for Healthcare Transformation and Technology for the Deloitte Center for Health Solutions. Our agenda today is going to consist first of approximately an hour, again, viewing our agenda topics with a perspective from each panelist, Then I encourage the second hour for a lively engagement of questions and answers to engage the panel and dive deeply into the topics and the areas of interest that we glean from that discussion.